Oxygen, the most important gas used for medical therapy. Other gases used for medical therapy are helium-oxygen combination known as heliox and nitric oxide. Now, what are the indications of oxygen therapy? Oxygen therapy is indicated in adults when the arterial pressure of oxygen decreases below 60 mmHg or the saturation decreases below 90% on room air. In neonates, the figures go little down to be less than 50 mmHg for oxygen pressure and 88% for oxygen saturation on room air, or the capillary oxygen pressure less than 40 mmHg. The main aim of oxygen is to prevent or to correct tissue hypoxia. These are the indications of oxygen therapy. Respiratory failure, either hypoxemic or hypercapnic, acute asthma, acute myocardial infarction without respiratory failure, normoxemic hypoxia, perioperatively for the prevention of surgical wounds, post-operative state, before tracheal suction and bronchoscopies, and finally in cluster headache. In acute asthma, the aim of oxygen therapy is to protect against hypoxemia resulting from pulmonary vasodilation following the use of beta-2 agonists. And of course, it's indicated if hypoxemia is already present. The third indication is in the presence of forced expiratory volume 1 or peak expiratory flow rate less than 50% in the absence of oxygen monitoring, which is difficult somewhat today. In acute myocardial infarction, oxygen therapy has the following values. Hypoxemia may develop due to VQ mismatch and excessive lung water. Second, the use of nitroglycerin will dilate the pulmonary vascular bed and increase ventilation perfusion abnormalities, and this will lead to hypoxemia. However, this occurs for just 2 to 3 hours, and this is time enough to use oxygen in them. For uncomplicated cases of myocardial infarction, excessive administration of oxygen will lead to systemic vasoconstriction and maybe hypoventilation in COPD patients. So, it's not advised to give more than 40% inspired fraction of oxygen. However, in complicated cases of myocardial infarctions, for example, by heart failure, oxygen requirement is guided by the arterial pressure oxygen monitoring. Another important indication of oxygen therapy was called normoxemic hypoxia, a condition in which there is tissue hypoxia but the arterial pressure of oxygen is normal. Examples of this are acute anemia, carbon monoxide poisoning, and sickle cell crisis. And by the way, for carbon monoxide poisoning, hyperbaric oxygen therapy is indicated rather than oxygen at ambient air. Post-operative state. Following surgeries, there is increase in alveolar arterial oxygen gradient and decrease in the function residual capacity. This will lead to VQ mismatch, which may progress to shunting. However, in peripheral surgeries, this problem persists just for a few hours. However, this problem is significant in elderly patients, in obese patients, those with cardiopulmonary diseases, and patients subjected to thoracic and upper abdominal surgeries. In these patients, oxygen therapy post-operatively may be required for up to 2 days. Now, what is the end point of oxygen inhalation? Simply, it is satisfactory increase in the arterial pressure of oxygen or the saturated pressure of oxygen. Increase in the arterial pressure of oxygen during inhalation is not an evidence of increased tissue oxygen availability. Simply because oxygen has a tendency to reduce systemic blood flow. Now we're going to talk about the oxygen therapy devices. The performance of the devices depends on several factors. Number one, the type of the device, either mask or cannula. The flow rate of the device, 1 liter or 10 liters. Fit of the device, inspiratory flows of the patients, respiratory rate, and tidal volume of the patient. Examples of high flow or fixed performance oxygen therapy device equipments are the bag mask valve systems or anesthesia bag or the ambu bag, the venti mask or high airflow oxygen entrainment mask, and finally, and the most recent, is the high flow nasal cannula. The high flow nasal cannula is heated and humidified, and it is used in acute hypoxemic respiratory failure in all age groups. It's not just a standard nasal cannula cranked up to very high flow rates. It actually takes gas and can heat it to 37 degrees centigrade with 100% relative humidity and can deliver from 0.21 up to 100% inspired fraction of oxygen at flow rates up to 60 liters per minute. The flow rate and the inspired fraction of oxygen can be independently titrated based on the patient flow and oxygen requirements. The high flow nasal cannula should be snugly fit into the patient's nares and prevents the entrainment of room air around the cannula, contrary to what occurs in the standard low flow nasal cannula. Rock and colleagues has introduced what's called ROX index, which is a simple index used to predict the success or failure of high flow nasal cannula. It was tested at the 2nd, the 6th, and the 12 hours. The ROX index equals the saturated pressure of oxygen measured by pulse oximetry divided by the inspired fraction of oxygen percentage divided by the respiratory rate of the patients. ROX index equal or more than 4.88 is associated with significant success and no requirement for endotracheal intubation. Now, what is the advantage of high flow nasal cannula or how it works? You can remember this by the letters high flow. H goes for heated and humidified. As we said before, it's heated to 37 degrees centigrade and humidified to nearly 100%. Number two, I. It meets the inspired demands of the patient. I mean patient with high inspiratory peak inspiratory flow rates. Number three, it increases the function residual capacity, most likely by producing PEEP. Each 10 liters per minute flow will produce 1 millimercury of PEEP. Next, it's lighter and more tolerated than CPAP and BiPAP. The oxygen dilution is minimized by meeting the flow. This is because it fulfills the requirements of the demand of the patients, so there will be no entrainment of air from the atmosphere, and hence there's no dilution of the delivered oxygen to the patient. And finally, the high flow washes the dead space, which is reflected on better carbon dioxide removal. As we see, the flow meter and another button for oxygen concentration adjustments, as we said before. Both the flow rate and the FiO2 are set independently, and we see the temperature and humidifier. And these are two breathing systems by two different manufacturers, to which the high flow nasal fan is attached. There are two main companies that manufacture these devices. Vapotherm, which has a device that can deliver flow up to 50 liters per minute, and Fisher Paykel, who offers both the OptiFlow as well as the Airflow, two devices which can both deliver flow rates up to 60 liters per minute. Each company offers smaller cannula sizes for premature neonates, as well as children of various ages, to adult cannulas. Each cannula, as we said before, should snugly fit into the patient's nearest and prevents the entrainment of room air around the cannula, which can occur with the standard nasal cannulas. Each manufacturer also have a max flow rate for each cannula size, corresponding to the size and age of the patient. What is the name of the oxygen theory? It's called free radical oxygen theory. The oxygen free radicals are superoxide, hydrogen peroxide, and hydroxide free radical. The enzymatic free radical scavengers are catalase, superoxide dismutase, and glutathione peroxidase. What about the relation between glutathione and N-acetylcysteine? N-acetylcysteine is a glutathione analog capable of crossing cell membranes and enhancing the intracellular glutathione activity. And this is the mechanism of the beneficial effects of an N-acetylcysteine in the acetaminophen toxicity. Non-enzymatic free radical scavengers are catalase, glutathione peroxidase, and superoxide dismutase. Why there is little free iron in the plasma? Because free iron is pro-oxidant. The safe unlimited duration of Fi2 in healthy person is half, but in critically ill patients it is 0.21, similar to room air, because simply these patients may have deficient amount of oxygen free radicals. The low flow oxygen therapy devices are nasal cannula or nasal sponge, simple mask, and the reservoir masks. Fixed performance devices are the bag mask valve and the venti mask or high airflow oxygen in train. The oxygen device therapy that can deliver up to 100% oxygen with non-rebreathing reservoir mask. The maximum flow delivered with the nasal cannula is 5-6 liters per minute. The disease in which the venti masks are used is the chronic obstructive pulmonary disease. To produce a controlled oxygen therapy, difference between partial rebreather and non-rebreather. In non-rebreather, there is a one-way valve that prevents the exhaled air from going in the reservoir bag. A simple mask is not appropriate to deliver less than 0.35 FiO2 because delivery of this low FiO2 requires the use of low flow of oxygen, which will lead to carbon dioxide rebreathing. Because the reservoir bag mask has room of 150 ml to 250, contrary to the nasal cannula, which has a 50 ml only.